Hannah. I'm going to be the physician assistant student performing your exam today. So the purpose of this exam is to perform an abdominal and musculoskeletal exam. So before we get started, I'm going to ask you to take your shirt, your shoes, and your socks off, as well as empty your bladder if you need to, and I'm going to go wash my hands in the meantime. Okay. To begin with our exam, I'm inspecting the contour of the abdomen. I'm ensuring that we have adequate exposure to the xiphoid process and the pubic symphysis. So I'm inspecting the contour of the abdomen, noting the presence of any scars, striae, distension, masses, pulsation, and the condition of the umbilicus. I'm then going to auscultate the abdomen. I'm going to auscultate in all four quadrants, listening for bowel sounds. If bowel sounds are not immediately heard, I would listen for 1 full minute in each quadrant. I'm going to start this quadrant here. And bowel sounds are normal active in all four quadrants. Next, I'm going to be percussing the abdomen in all four quadrants for tympany and dullness. So I'm going to be percussing and then I will also be percussing for splenic enlargement at the lowest intercostal space on the anterior axillary line. So I'm going to find the lowest intercostal space. I'm going to have you take a deep breath in for me. Perfect. All right. And next I'm going to be palpating in all four quadrants. So if the patient, I would ask if the patient had any pain, and if she did, I would palpate that quadrant last, and then I will also be observing the patient's face, noting for any signs of distress while I am palpating. So first I'm going to palpate lightly in all four quadrants at about 1 centimeter depth, noting any superficial masses. Next, I'll be palpating deeply at about 4 centimeters, noting the presence of any deep masses. All right, and then I'm going to palpate for liver enlargement. So I'm going to be noting any enlargement, masses, or tenderness. So I'm going to have you take a deep breath in for me. Okay, breathe out. And then I'm going to have you breathe in again for me. Okay, perfect. And I would have my hand under her while I did that. And then I will be palpating in the left upper quadrant for splenic enlargement. I'm going to have you take a deep breath in for me. Okay, breathe out. And then breathe in. Perfect. And breathe out. All right. And then I'm going to have you sit up for me. And I'm going to be palpating for costovertebral angle tenderness. Perfect. And then I would also perform a rectal exam at this time, and that completes the abdominal portion of the exam. Next, we're going to move on to musculoskeletal. So I will be inspecting and percussing in the following areas, noting for any signs of symmetry, signs of inflammation, edema, effusion, tenderness, deformities or malalignment of bones, muscular atrophy, abnormal movement, condition of tissues, crepitus, and any and the ease of range of motion. Good. All right, so to begin, I'm going to have you stand up for me. I will be inspecting the anterior, I will be inspecting the posture in the anterior and posterior regions, noting the alignment of the shoulders and the pelvis. I'll be inspecting in the posture in the lateral aspect, noting the lordotic and kyphotic curvatures. Then I will be inspecting the area over the trapezius, the scapula, trapezius scapula, the spinous processes, the paravertebral muscles, and the sacrum. I will also then be palpating the spinous processes and the paravertebral muscles bilaterally. as well as the sacrum and the sacroiliac joint. Perfect. All right, and then next we are going to assess your range of motion. So we're going to assess your cervical range of motion. So I'm going to have you follow me. So we're going to do flexion. So put your head down, extension, put your head back. You're going to do lateral rotation. So turn your head right and left. And then I'm going to have you put your ear to your shoulder without bending your back. Perfect. And then the other side for lateral bending. Perfect. All right, then we're going to assess lumbar and thoracic range of motion spine. So I'm going to have you turn towards me. I'm going to stabilize your hips. I'm going to have you bend forward for flexion. Touch your toes. Perfect. Come back up. Bend backwards for extension. Perfect. And then I'm going to have you turn to the left or the right, whichever one. Perfect, for lateral rotation. And then I'm going to have you put your bend to the side with sliding your hands on your thighs for lateral bending. Perfect. All right. And then I'm going to be inspecting the TMJ. Oh. So I'm going to be inspecting the TMJ region, and I'm also going to be palpating the TMJ. So I'm going to have you open, close your mouth, put your jaw side to side, and put your jaw frontwards and backwards. Perfect. All right, great. Now we will be inspecting the upper extremities. So I'm inspecting the shoulders, the arms, the forearms, the elbows, the wrists, and both of the hands and the fingers. Perfect. And then I will be palpating the clavicle, the acromioclavicular joint, the scapula, the distal or the biceps groove and the tendon, bicipital groove and tendon, and then the arms. I'll be inspecting the medial and lateral epicondyles, the radial, proximal radial head, and the electron process. And then I'll be inspecting the forearm, and then the carpal bones, the radial, the ulnar, and the radial styloids. So radial ulnar styloids, the anatomical snuff box. I'm gonna have you flex your hand for me. Perfect. And then the metaphalangeal joint, as well as the interphalangeal joints. Yeah, both sides. So we have the radial and ulnar styloids, the carpal bones, metacarpophalangeal joints, the interphalangeal joints, and anatomical snuff box. Perfect. And then you can have a seat now. Oh wait, sorry. One more thing I'm gonna have you stand up for.
Okay.
Oh yeah, we're gonna do assess your shoulder range of motion. So I'm gonna have you lift your arms for flexion, put your arms back for extension. We're gonna do abduction, adduction, and then shoulder external rotation, internal rotation, and then circumduction. Perfect. And then I'm gonna have you hold your arms out like this. We're gonna do elbow extension, flexion, elbow extension, and then we're gonna put your arms down a little bit. We're gonna do pronation, supination, and then we're gonna do wrist flexion, wrist extension, and then I'm gonna stabilize your wrist here, and I'm gonna have you put your pinkies inward for ulnar deviation, and then outwards for radial deviation. Perfect. All right, now you can have a seat. First, we're gonna do fingers. Sorry. One more thing before we sit down. So we're gonna do, start with your hands out like this. We're gonna do thumb flexion, finger extension, thumb extension, finger adduction, finger abduction, thumb adduction, thumb abduction, opposition. Perfect. Okay, now you can have a seat. Okay, now we're going to move on to inspecting the lower extremities. So I'm inspecting the area over the hips. She would have shorts on. Area over the hips, the thighs, the knees, the legs, the calves, the Achilles, ankles, feet, toes. All right, then I will be palpating the hips, the ASIS, greater trochanter, the legs, the medial and lateral femoral condyles, the patellar tendon, and the tibial tuberosity, as well as the legs, the calves, the medial and lateral malleoluses, the calcaneus, the Achilles tendon, the tarsal bones, metatarsal phalangeal joint, the interphalangeal joint on both feet. And then I will do the same over here. So Achilles, calcaneus, tarsal, metatarsal phalangeal, interphalangeal. Perfect. Ticklish. Okay, then I would go wash my hands, and then now I will be assessing the range of motion in the lower extremities. So I'm gonna bend your leg up for me. We're gonna do hip flexion, knee flexion. Then we're gonna do knee extension, and then we're gonna bend your knee again. I'm gonna do internal rotation and external rotation, and then stabilize your other hip. We're gonna do adduction and adduction, and then I'm gonna have you turn to your side for me. And we're gonna do hip flexion, perfect, and you can lay it on your back again. Thank you. And then we're gonna do the other leg, hip and knee flexion, knee extension, flex again, external rotation, internal rotation, adduction, abduction, and then you can turn towards me on your side again. Hip flexion, extension, hip extension. All right, and then I'm going to assess the range of motion in your feet. So we're going to do, I'm going to stabilize your foot here. We're going to do plantar flexion, so put your feet down for me. Dorsiflexion, so flex up. And then we're going to do inversion and eversion. And inversion, eversion. All right, and then I'm going to stabilize your toes here. I'm going to have you curl your toes for me for flexion and then straighten for extension. Perfect. Okay, and now I'm going to measure circumference of your calves. Perfect. I'm going to go with the widest part of your calf. And we have about 31. I'm going to measure the distance from your tibial tuberosity, which is 7. And we'll measure the other side. Right, and lastly, I'm going to use my goniometer. I'm going to have you bend your knees in as close as you can to your butt. Perfect. All right. I'm going to place the goniometer here at the greater trochanter. I'm going to measure the angle, which is about 140. And it will, go ahead and turn around for me. Perfect. And also about 140. And that completes your exam.